The way in which I described urgent care to maybe colleagues or even students that I've worked with is imagine UCSD has an emergency room for mental health concerns or concerns that you feel that cannot wait. And so, that really opens the door to students who subjectively feel, they have an urgent concern. And the way in which we've seen them this year has been through phone, video, or in-person visits. So I think that's also opened the access to the ability for students to reach out for help and get some contact there.
For myself, I think of triage and urgent care as being very similar in that you're trying to assess the needs of the student and also connect them to the most appropriate resources. And then that's where they start to differ just ever so slightly. Typically with urgent care, you're working with students who are maybe having a higher level of distress, or there's more higher, I like to use kind of like activation of symptoms or experiences that are happening for them. And so something that I think is important for all of our work is really building rapport with our students to be able to encourage different interventions, if there's referrals that need to be followed up on. But I think that's especially important when working for urgent crises and urgent situations, because it might be a time-sensitive matter and you might be making recommendations that the student is not maybe as familiar with or maybe might have some hesitancy with. So I think that's really important at urgent care, is being able to establish that rapport and that connection with them in a way that's very client-centered so that we can help direct them to what's needed for them.
It's a much faster pace than doing a traditional triage. And, you have to be astute with regard to managing suicidality and various things that you may not see in a traditional triage that you're conducting.
The behavioral health postdoc does not participate in the same urgent care schedule as folks who are at CAP's central office, as the Student Health Services has their own urgent care for students who are coming in for a range of things. They fell off their electric scooter without wearing a helmet. They, have other urgent needs. They may have COVID. They may have other urgent concerns that they come in for. And if the provider has identified a need maybe for additional support, we get contacted to come down and provide some consultation to both the provider and to the student to help them move on to the next resource, whether that be maybe follow-up care with behavioral health and they become one of our clients, or we get them connected with other resources they're already connected with, or into the community and what seems best.
I think it's important that going into urgent care, you have to be emotionally and mentally prepared, because again, there's a lot that is occurring. There's a lot of different things that are happening, from walk-ins to secure messaging to telephone calls to various things of that nature, the ways in which we receive referrals. So it's important to be able to multitask in a high-paced environment, and also being efficient and an excellent team player, because you need to keep others abreast, because it's a team approach.
I think what's interesting about UCSD CAPS is that because we are embedded in the larger UCSD health system, we are connected to the medical record keeping. And so the reason why I bring that up is, so for example, this past year, having done several hospitalizations, when we would streamline or initiate contact with off-campus providers or even with our partners in the different health system, we were able to follow them along in terms of documentation. And so actually that gave us great access and efficiency to get connected to the local ERs. We have great partnerships with our health partners across the region in San Diego. And so I think that's really helped, at least in my experience, getting folks into the proper care or potential higher levels of care that they need.
Being able to develop that crisis intervention role, and particularly, given that students may have suffered some sort of physical injury as a result of their mental health condition, that I noticed seeing sort of a different level of acuity than I have traditionally in previous counseling and crisis intervention roles. So students who, as a result of self-injury or some direct effect of their mental health condition and their ability to care for themselves, sought an urgent care visit with the provider to, of course, tend to their condition physically. And so those were some opportunities that I had to support a student and to meet with them.
Also making sure that we're engaging in safety planning, which might not be as present when doing a traditional triage, and trying to also find it in a way that isn't pathologizing, stigmatizing to the student as well. So really making sure that this is, we genuinely care about your safety, and how do we do so in a way that helps support you and we make sure that you are safe.
There are times where we, can initiate both involuntary or voluntary hospitalizations. We also too get contacted for students, given that all students who come in through student health services receive a PHQ for monitoring depressive symptoms, that if it's at a certain range, that some providers will also contact us if they're even in a different clinic that isn't directly in the actual physical urgent care, that will go to that department and connect with that student as well. So we go to a lot of different departments to connect with both providers and students. And then sometimes we actually, given that we go down to urgent care physically, we sometimes will physically actually conduct a session in a medical office. Really, again, to increase that access and meet students where they're at.
This past year, CAPS reconfigured urgent care. There is now a program coordinator, which has been very valuable as far as helping with the continuity of care and support.
The hopeful thing about here is that to know, at least coming in, will be that you're either the primary clinician for that urgent care shift, or you're the backup, or sometimes you do have backup, or sometimes you are alone, but you do have the support of more senior staff that are available there, like the director of urgent care. You also have a larger group of support staff who are helping you kind of like let you know that there's someone coming in, there's another person coming in, so you're not truly alone, but you do have those other forms of support. At least for me, it was a great experience to get that kind of unique experience, because you are going to get people who are in high need in that moment, whereas in triage you may or may not get that experience.